ANA's Fast 15, a virtual training module designed to help you and your chapter succeed. As always, the success of ANA depends on volunteer leaders, so thank you for your commitment to ANA. This is a chapter officer module for the health policy representative. But wait, before you begin, be sure to complete these two Fast 15s, the ANA Governance Fast 15 and the Officer Basics Fast 15. These will help you better understand ANA and the basis for volunteer leadership within the American Nephrology Nurses Association. We hope this virtual training module for the health policy representative will help you better understand the function of this role. In it, we will provide examples, tell you where to find the tools you need to get started, and help you identify any additional resources you may need. Remember, there's a rapid change in healthcare today. Our professional lives as nurses are and will be influenced by legislation at the state and national levels. Health policy reps play a vital role in keeping members informed and urging them into action. We promise to keep it to just 15 minutes or less because we know how valuable your time is. Remember, the Health Policy Rep is a member of the Chapter Executives Committee. As a health policy representative, you will need to familiarize yourself and understand ANA's strategic plan and mission statement. You also have an important job in keeping up with legislation and regulatory activity. The Health Policy Rep is instrumental in educating chapter members about these changes. Use your role to educate your chapter members about what they can do to spread the word and how to be advocates. An easy way for members to get involved is by sending letters via CapWiz. Of course, this all takes time, but we want volunteer work to be a joy, not a job. Initially, there will be extra time needed just to familiarize yourself with the information on the ANA website, possibly up to 1 to 2 hours, just to look at the items under the Advocacy tab. As always, time commitment will vary throughout the year, and preparing for the Kidney Disease Awareness and Education Week, or KDAE Week, can be consuming. Plan on attending chapter executive board meetings and conference calls as needed. A good policy is to follow up and check your state legislation and regulatory activity on a weekly basis for items related to CKD. I know this sounds a lot for every week, but if you wait until the last minute, a lot of the information can overwhelm you. The Health Policy Committee will hold 2 health policy conference calls and 1 KDAE week call per year. Please try to attend these. The health policy rep should be organized, committed, passionate, and knowledgeable about ANA. Realize there are some common myths that you will have to debunk and questions to answer. Will it be hard? I already acted once. Do I have to act again? I am not the same political party as my elected official. I am just a nurse. What can I do? I am too busy to act are just some of the barriers who will hit. Remember, ANA makes representation easy and fast. Congressmen do want to hear from nurses. They consider them expert. It only takes one person to make that difference. The best place to start on your journey as a health policy rep is the VLW, or Volunteer Leaders Workshop. There you will learn more about creating chapter work plans, being an effective leader and advocate, and organizational skills. You can learn how to be a mentor and find the perfect mentor for yourself. Can't or didn't make it to the VLW? Well, ANA has many resources to help you succeed. There are additional Fast 15s on a variety of subjects. How well you complete these tasks depends on communication, collaboration, delegation, and completion of the tasks that you have been asked to do. The health policy rep can also make sure his or her chapter is running for the Advocacy STAR Award by making sure to record any STAR points the chapter is eligible for. Don't know anything about stars? Well, have no fear. There's a Fast 15 about STAR points. To begin, work with your outgoing health policy representative. He or she will be an excellent resource person as you transition into your new position. Gather and familiarize yourself with any health policy documents the chapter has, especially those regarding correspondence and activity reports. Be an advocate by staying current with local, state, and national issues, and those of your state board of nursing. Familiarize yourself with CapWiz. Educate chapter members. Be the resource person to your chapter and nephrology nurses. Review the Health Policy Handbook and other resources found under the Advocacy tab on the ANA website. Note any deadlines found in the calendar and check frequently. You could also use an Outlook calendar, whatever works best for you. Make sure to review the Policy and Procedure Manual and work on the chapter work plan, concentrating on advocacy activities for your chapter. Once again, develop and track your chapter's progress on the work plan, and don't forget to enter your STAR points.
Start the cycle of communication by submitting a letter of introduction to your State Board of Nursing and key legislators. There's an introduction letter template located under the Advocacy tab on the ANNA website. Make sure to sign up to receive emails from your State Board of Nursing and elected officials, both on the state and national level. Remember to check your emails frequently and respond promptly. Occasionally, an issue may arise in your state that ANNA wishes to weigh in on, so you may be requested to represent ANNA on a state committee, coalition, task force, or work group. Make sure to call and visit your legislatures, their staff, and the state government agencies to educate, discuss legislative processes that will impact ANNA and nephrology nursing. Make sure to establish those relationships for future contacts.
The Kidney Disease Awareness and Education Week, or KDAE, is a major event for the health policy representative. This is held every year during the second full week in August. Start planning early, though. To get an elected official into a nephrology-related clinic takes planning and perseverance. Have already had an elected official visit? Try getting him or her into a different nephrology-related clinic. If he or she has visited a dialysis unit, get him or her to a transplant facility. Also remember that the staff of an elected official frequently changes, so there's always new people who need to be educated. The more people in the know, the better. Remember, you are never alone. The Health Policy Committee has members assigned to assist your chapter, and also there are many great resources available on the ANNA website. This is the structure of the ANNA Health Policy Committee. The Health Policy Rep is the eyes and ears at the local level for the Health Policy Committee. The Health Policy Committee will keep you informed of events at the national level, but they rely on you to keep them informed of what's happening at the state level. And also, they rely on you to educate your chapter members and fellow nephrology professionals. So where do you find your advocacy resources? Well, let's start with the ANNA website. Log on to annanurse.org and click on the Advocacy tab. Under this tab, you will find the Health Policy section that contains the ANNA Health Policy Agenda, which tells you what ANNA as an organization wishes to accomplish during the legislative year. The Health Policy Statement, which defines ANNA's viewpoint on major public policy issues relevant to the treatment of individuals with kidney disease and the practice of professional nephrology nursing. This document serves to give ANNA direction on legislative and regulatory issues at state, local, and national levels. It has been developed based on a comprehensive review of current issues and with input from ANNA members and leaders. You can also find the Health Policy Handbook in the Health Policy section. Under the Resources and Tools sections, you will find the CapWiz link, a one-stop shop for contacting your nationally elected officials. ANNA's legislative priorities and endorsements that ANNA has taken part in, and our position statements on a variety of subjects. Also, you'll find examples of a comprehensive interdisciplinary patient assessment, information on CMS coverage for ESRD, and the ESRD briefing book. Additional information on health policy events and state health policy information, such as state laws and regulations related to dialysis, nursing regulations from state boards of nursing, and the state fact sheets regarding the number of CKD patients in any particular state. There's a lot of useful information under this tab. Let's talk more about CapWiz. Remember how I said it was a one-stop shop for information and contacting your elected official? This is a list of just some of the things you can do via CapWiz. To get there, click on the Advocacy tab, then choose Take Action. Take time to view the Legislative Action Center tutorial. It is packed full of useful information and walks you through CapWiz step by step. When I discussed gathering resources earlier, one of the must-have resources is the Health Policy Handbook. To get to it, choose Advocacy, then the Health Policy Handbook. Make sure to review this handbook and have it available for future review if you have any questions about your health policy role. More of a hands-on person? Well, every 2 years, ANNA has a health policy workshop. We just held one in June of 2013, so the next one will be in 2015. But every year, there's a Nurse in Washington internship, or NEWE grant, available through ANNA. The applications for this grant is due November 15th. Want to find out more about these events? Once again, go to the Advocacy tab on the ANNA website. There are other resources available that are not ANNA related. There's things such as the ESRD networks, which are loaded with statistics and helpful information. There's a National Council on State Board of Nursing that can give you information on what is happening at your State Board of Nursing. And of course, there is the CMS website that deals with ESRD. To keep you abreast of state activity, each state has its own website. Type in the state mnemonic followed by .gov to access the site. Look for the legislative branch link. Usually these will give you a link to any current legislation that's being considered. You can use the search feature to look for anything that deals with CKD. Be creative in the search terms used to find the legislation that is out there. For general information on being a chapter officer, log into the ANNA website, choose About ANNA, then Chapters, then Chapter Officers Only. The Chapter Officers Only section will only appear after you have logged in, and if you are a new chapter officer, after the National Symposium in April. More of a people person? Remember, you are not alone. ANNA has over 9,000 members. That is a lot of diversity and experience. Make sure to tap into other chapter officers, the staff at the national office, and other ANNA members. The Health Policy Committee is just a click away. You have a member of this committee assigned to your chapter. These are ANNA members with experience in health policy. Make sure to communicate. Send a letter of introduction to your senators, representatives, state officials, and State Board of Nursing. There are introduction letter templates available on the ANNA website. Make sure to send your nationally elected official this letter via CapWhiz or email. If you use snail mail, it will be delayed forever to the National Post Office to make sure it has no ricin, TB, malaria, flu, or any other nasty bugs on it. Also, make sure to sign up for your state elected officials' email list. You will receive emails from them about current issues that they are involved with. Communicate with your chapter members. Send out your contact information either via the email member list, a chapter newsletter, website, Facebook page. Let them know that you are there as a contact for health policy related issues. Always try to promote advocacy. Give a talk at a chapter meeting. Show the members how to use CapWhiz. Use ANNA Connected to forward any information you receive from the national office. Remember, if you do use regular email to write your chapter members, use the BCC or blind copy to keep everyone's email address private. What is ANNA Connected? Well, it is ANNA's preferred method of communication. Remember, a chapter receives star points for using ANNA Connected. Don't know how to use it? Well, guess what? There's a Fast 15 for that. What are star points? Well, they are ANNA's way of recognizing and rewarding chapters for outstanding work. There's a specific star award for advocacy. You can earn advocacy points in a variety of ways. Star points are awarded for correspondence. Those letters of introduction, guess what? Star points. Letters sent out via CapWhiz, star points. Participating in KDAE events, ka-ching, ka-ching, lots of star points. Doing chapter education about advocacy, more star points. Participating in health policy related conference calls, even more star points. Still have questions? Well, have no fear. The Health Policy Committee and ASSIST is here. These are committees of dedicated ANNA leaders whose goals are to help support you and help you succeed your success as an ANNA volunteer leader. Well, that has been a Fast 15. Make sure you go back to the Chapter Officers Only section and complete the short Fast 15 survey. We use the survey to gather valuable feedback, get additional ideas, and give you the opportunity to tell us what you need to succeed as a chapter leader. Star points are awarded to chapters who have officers who complete Fast 15s. Thank you, and have a great advocacy-filled ANNA year.